why? So the question is, why do you want to lose weight? Is it for health? Is it for beauty? Is it for aesthetic? Because we have to be very clear why we are doing it. So most common reason that I hear from the patient is that I want to fit in into my old clothes, or I have a wedding to attend. So again, we have to be very clear: is our goals health related, or aesthetic related, beauty related? Because the more deep our goals are, the better the outcome. Let's put it that way. The other thing that I want you to think about, which is more important, and you will see me repeating all the time. So it's not about numbers, it's all about health improvement, functional improvement, and improving the quality of life. So think in that terms. So we have talked about why. The next thing is that we need to know to whom we are doing it for. Is it for me? So we call it in our behavior word, is it intrinsic pressure, or it's an extrinsic pressure? Am I doing it for myself, for me, myself, and I, or am I doing it for others? Right? So am I doing it for my job? Am I doing it for my spouse? Am I doing it for my dress? Am I doing it for my children? Am I doing it for my doctor because my doctor told me? Because that will heavily impact the outcomes and the way you're thinking. So losing weight to please someone, the motivation does not last long. So again, so I want you to think about it, and be very clear in this journey what we are doing. So this is a common mistakes and errors that we have seen people making, people doing the error. So that's why the behavior psychologist has come up, and right now this is the main core, or the main thing that drives you, is not to think about goals but think about values. So the way that we are teaching our patients is that the value is something that is unlimited. It is unrestricted. It is infinite. It is something that is not achievable, so you're always striving for it. So goals are opposites. Goals are finite, restricted, limited. Once you achieve it, you scratch it off, and you have to make up a new goal, so that you have to have a new motivation for it. So let's say I want to be 150 pounds. Once achieve 150 pound, what's next? You have to make another goal. You have to come up with a new action plan. You have to be motivated again. But the value would be like ingrained, where it's directing your action. So I want to play with my grandkids, right? So if you want to play with your grandkid, is it achievable? Yes, it is achievable, but you're working towards it. So every day you're playing with grandkids, right? So, or I want to see my children growing older, right? I want to. So this is something that is big, always drives you, and then keeps you motivated. So this is what we want you to think about. Think about value. Think about that this is a compass. This is your GPS driving all your actions, and then you can relate to it, that am my actions are in align to my value. So think out of the box. Think bigger picture. Don't be narrow minded. The other piece is support system. It's very important whenever you are striving for a behavior change. Either it's a small behavior, doing flossing in the night, or waking up 6 in the morning. Any behavior change requires support. So see who's out there for you. Is your efforts, is your behavior is supported? Would you find some sabotagers, triggers, any people who will knock you off? Right? So think about that. Then see how many people are committed with you to do that or support you in your journey. You are ready for change, but is your family ready for you? For you to change your behavior, because some behavior requires everyone's support. So so all these action planning requires lot of thinking. So I want you to think about it, and then in the end, again, the stage 3: are you ready for change? Am I ready for change? Am I ready now, or when I will be ready, right? So how many of you are ready for a change?